Hello guys, today I have just compiled a set of few important ECG strips which you must know before going to any exam. So I have compiled mainly the mostly asked questions. So let's see. First one. First one is J wave or the Osborn wave. It comes right after the QRS complex. It is seen in hypo hypothermia. Mind it, guys, it's hypothermia and hypercalcemia. Hypothermia and hypercalcemia is J wave or the Osborn wave. The next wave is the delta wave. If you see, the delta wave comes after the P wave and joins with the QRS complex. Delta wave, most of you should know it already. Delta wave is seen in Wolf Parkinson White syndrome, where there is this bundle of Kent and causing different conductions. Wolf Parkinson White syndrome. There are two types. Type A, when the bundle of Kent is in left side of the heart, and Wolf Parkinson syndrome type B, the bundle of Kent is in right side of the heart. This causes abnormal conduction within the heart, causing this delta wave. And next ECG strip is, this is also an important one. This is epsilon wave. Epsilon wave, it is seen in arrhythmogenic right ventricular dysplasia. Arrhythmogenic right ventricular dysplasia is epsilon wave. Next strip is, first try to identify the strip. This one is monomorphic Vt, monomorphic ventricular tachycardia. As you see, all the length is equal. Now if you see, there is an important sign in this monomorphic VTAC. It is this notch. This notch that is seen is called as Josephson sign. Josephson sign. That is just before the QRS complex reaching the nadir. There is a small notch. This is Josephson sign seen in V ventricular tachycardia. The next one, and an important one, this is a pattern of ECG. This pattern, what is this pattern? This pattern is Cove pattern. Cove pattern seen in Brugada syndrome. Brugada syndrome. This is a type of ST elevation. This is seen in Brugada syndrome. Cove pattern. As you know, Brugada syndrome, and additional information, it is the defect of the sodium channel SCN5A. Mind it, guys, it's 5A. Okay, 5A. If it is 4A, SCN4A, it is defective in hyperkalemic periodic paralysis and paramyotonica congenita. But that is not our discussion. Our discussion is Cove pattern and Brugada syndrome, SCN5A. And the next one, and the last one is, if you see this this ST elevation, this ST elevation is convex upwards, that is convex upwards like this. So it looks like this sad smiley. What is sad? Getting myocardial infarction is sad. So party sign is seen in myocardial infarction. To compare this with this ST elevation, if you see this is concave upwards. This ST elevation is concave upwards, smiling. So this patient smiled because he did not get MI. He got acute pericarditis, which is less mortal when compared to MI. So remember guys, if there is concave upwards, think about this smiley. This is acute pericarditis. This will be seen in all ECG leads. But this party sign, this is convex upwards. This one is seen in myocardial infarction, party sign. Okay guys, these are some important ECGs you should know. So as just a recapitulation, J wave or Osborn waves are seen in hypothermia and hypercalcemia. Delta wave is seen in Wolff-Parkinson-White syndrome. Epsilon wave is seen in arrhythmogenic right ventricular dysplasia. Josephson sign is seen in ventricular tachycardia. Cove pattern is seen in Brugada's syndrome. And party sign is seen in myocardial infarction. Party sign is convex upwards, ST elevation convex upwards, myocardial infarction. If ST elevation is concave, it is acute pericarditis. Thank you guys, hope it was useful to you. Now all the best for your exams.